Hello, this is Dr. Vanderwell, and I use the Apollo Overstitch a lot for a lot of medical procedures, particularly the ESG, the Endoscopic sleeve Gastroplasty. I also teach some of the courses for ESG and for the Apollo Overstitch. I'm making this video for everyone out there who's interested in getting more comfortable with this device or going through the training. The goal of this video is to help you conceptualize and also just give you some practice targets of things that you want to be able to just feel really comfortable with this device certainly before you do any procedures, but even before you show up at the training. The more comfortable you are with this device, the more times you've cycled it through, and the more that has gone from having to think about every movement to muscle memory, the more you will be able to get out of the training, and the better you will be able to do a procedure because you're not having to think about the device. You can just think about what you're doing on the business end in the patient. So just put together this video to help you kind of go through a couple of things and just a couple of drills to work on. And really by work on, I mean just like over and over and over. Like if you can have hundreds of cycles of a device before you show up at the training, that is perfect because the more comfortable you are with this, the less you have to think about this, the more you can get out of it. So, all right, so let's see. The way I like to think about this is the handle. This is the handle. This is the anchor exchange, and here is the helix. So first step, we're going to create some slack. So get some slack in the suture, set up the suture, close the handle, pop the suture onto the claw. You should feel a little toggle when the anchor and the claw both have attached with the needle. You'll feel a toggle where you can't really move it back or forth. It just goes a little bit. So now you're going to hit the button to release the anchor and then open the handle. And you'll see your needle is now on your claw. So you're ready to go. Now you're ready to take a bite. So you'll put the helix out. Your assistant will corkscrew it into the tissue. You'll pull it in. You got your tissue fold in there now, and then you're going to take your bite. So close the jaw, and then grab the needle. So anchor, pop. You should feel a little pop there. Get that toggle again when both are connected, and then actually you're going to pull it off to pull it off the claw. Open to release the tissue. There you go. Your suture is now passed through all of that tissue. So we just do it again. So reset, get set for your next bite. So get some slack, close the handle, pop, toggle, just give a little, yep, you're good, you're on there, button, and pull. I pull about a ½ centimeter back on the anchor, and then open. Helix out, helix back, close on the tissue, pop the anchor, and pull. And there you go, you have another bite. So the first thing you want to do when you're doing this is just practice those steps slowly. Just try to think about, okay, what am I doing? And then as you feel like you're doing a good habits to get into is only moving your anchor exchange and your helix just enough as you want to. You want to be a ninja with this thing. You need to just do what's necessary. Don't do anything. Don't do wild movements, like unless you really need to push that out there, but like especially don't pull it all the way back in the handle. You just want to pull it just enough that it's out of the way so that it's just teed up and it's just small movements for everything that you're doing. So close the handle, pop, you can give the toggle to make sure you're on, button, open, helix out, helix back, take a bite of the tissue, pop it on, pull it back, open, reset, slack, close, pop, button, open, helix out, helix back, close the handle, pop, pull, open. Do it again. Slack, close the handle, pop, button, open, helix out, helix back, close the handle, pop, anchor on, pull back. When you do this over and over and over, you're just going to start getting more muscle memory so that even if you're stuck like halfway, you can, and then look at the screen too for a while, especially for the first 100 or so times that you do this. That way you can kind of get a visual cue of where you're at on the screen. Because there's gonna be times where something will happen, you'll get distracted, you have to do something else, and then you need to come back to it and you're like, okay, where am I at? And what is the next action that needs to happen? And so the more that you are familiar with what it looks like and what you're gonna do next, the better you are going to be from a procedure standpoint, the more you'll be able to do, the better job you'll be able to do, because you're not having to think about this at all. All of your thought and your focus is on doing the skills for the patient. So get some slack. So then once you kind of cycle through this a bunch, do it 5 times with your eyes open. So slack, close, pop, button, open, helix out, helix back, close, pop, pull, open, slack, close, pop, button, open, helix out, helix back, close, pop, pull, open. Get some slack, close, pop, button, open, helix out, helix back, close on the tissue, pop, pull, open, release the tissue. Close, pop, button, open, helix out, helix back, close, pop, pull, open, slack, close, pop, button, open, helix out, helix back, close, pop, pull, open. There you go. So I was like, just 5 times, just nice and steady. The best thing you can do is just get into good habits. Take your time, work on your efficiency of motion, only go as far as you need to with pulling the helix back in, so you just want to have it just right there, teed up, ready to go. Don't be erratic with your motions, just enough as you need to. Practice good habits. And then once you've kind of done that about 100 times, do it with your eyes closed. So you go closing your eyes, first see where you're at, make sure you're not going to jam the device. So, all right, close my eyes, slack, close, pop, button, open, helix out, helix back, close, pop, pull, open, slack, close, pop, button, open, helix out, helix back, close, pop, pull, open, slack, close, pop, button, open, helix out, helix back, close the tissue, pop, pull, open, slack, close, pop, button, open, helix out, helix back, close, pop, pull, boom, open. There you go. And so just as many times you can run through that. Ideally you've run through this hundreds of times so that you are feeling really comfortable with this device, and then you can get the most out of your trainings. You can also do the best for the patient because you're thinking about just how you're going to fix the problem as opposed to how you're going to run the device. You got this.